Hi, welcome to the Doctor Who Show. I'm your host, Nick Cicero. Our guest today is Dr. Chad Rappaport, a dual board-certified foot and ankle surgeon. Dr. Rappaport is one of only a handful of surgeons nationwide that's certified in reconstructive rear foot and ankle surgery. He's been a staple in the Bergen County community for many years. Please welcome Dr. Chad Rappaport. Thanks for joining us today.
Thanks for having me.
So I read you were born in New York. What part?
I was born in Middletown, New York, and lived in Monticello until I was about 3.
3. And then your parents moved out where?
So we moved down to Bergen County and settled in Franklin Lakes, and that's essentially where I grew up.
Was your parents born and raised in Monticello?
Yes.
Yeah, okay. What did they do?
So it's kind of an interesting story. When my parents got married, my father was 33 and my mother was 17. My father was an aspiring performer or singer. He had 2 top 40 singles.
Get out of here.
Yeah, he was in show business, and his stock was rising. He had appeared on Good Morning America and a couple other...
For his singing or his acting?
For his singing. He was a singer.
Singer.
It's church bells ringing. It's Mother Nature in all her glory, the sweetest
Grandfather's permission first, and my grandfather said, listen, you're 33, she's only 17.
Right.
You're in show business, your stock is on the rise, you're starting to travel around. He was starting to do big supper club shows, they didn't have like stadium concerts back then and whatnot. But he said, you can have my daughter's hand, but you gotta give up the show business thing.
No way.
Yeah, so he gave it up. He was head over heels in love, and he gave it up, and ultimately went into the restaurant business with his family.
Well, that's interesting, right? Your grandfather was pretty smart.
Yeah.
He's like, you're not going to go on the road for 200 days a year.
Correct.
Marry my daughter and just leave her here.
Yeah.
Not happening.
No.
So he said that was the one thing he wanted was you got to.
That's the one and the only thing.
Wow. So
And,
his songs, were they anything I would know, or?
Probably not. This is back in the 1950s. It was Tony Bennett / Frank Sinatra type stuff.
Yeah. So he's a crooner.
Exactly.
Yeah. Okay.
Yeah.
Well, that's really cool.
Yeah. Yeah. I still have. He passed away about 10, 15 years ago.
I'm sorry to hear that.
That's okay. But I still have a scrapbook with all his articles and.
You have the songs, right?
Yeah. Yeah.
I definitely want to hear one.
Yeah, my mom a long time ago had them converted from the actual record to cassettes, and then subsequently cassettes to
DVD, CDs.
Yeah.
Wow, now you can just put it on the computer.
Yeah.
Matt, we'll have you do it. You put it all on the computer. Matt will put it on the digital for you, and you can do fun stuff with it. Do you have any like Super 8s of him, like performing?
No.
Oh,
No. I wish, but.
Yeah, that would have been cool.
Yeah.
I mean, having the diner, your dad, he worked there full time, and then he did his music career.
Yep, he worked there full time until he went to the Army, served in the Korean War. When he came back, he went back and worked in the diner, but he was a piano player. He loved playing the piano, and he was hired a few times to play piano in a local studio. And as luck would have it, one particular day, the singer, the artist who was scheduled to come and record a song never showed up. And it was for a commercial or something. I don't remember exactly what it is, but they asked my dad to fill in. They asked him if he could sing and play piano at the same time, and so he did. And the guy who was in charge was super impressed with his voice, and that kind of one thing led to another, and before he knew it, he was singing.
Wow.
Yeah.
That is a great story. See, that's why I love interviewing you guys. Like, no one gets this. No one sees this, right?
Yeah.
Your patients, you don't have time to sit there and talk about your dad or your patients, but this kind of stuff I just love. I mean, my friend owned a diner where I grew up, and we would just sit down in the basement and hang out at the diner, and it was the meeting place for everyone.
Yeah.
So that was, something for your dad to like, look, here's my anchor, but I can still chase my dream a little bit of the
Exactly.
singing and not worry about, I know I have this, I'm here, I'm good, I can
Fall
take
back
care of
on if
this.
I need to. Yeah.
Well, what made them move to New Jersey? What made them move to New Jersey?
So Monticello, this is back in the 70s.
70s.
It started to change. The dynamic of the town started to change. A lot of the business in town started to migrate elsewhere.
Yeah.
They just saw the writing on the wall, and they were right. Monticello now these days is not a great place.
Right.
No offense to Monticello, but.
Right.
They just wanted a better place to raise my sister and I.
So was the diner sold?
The diner was sold, yeah.
Oh, okay.
Yep.
So I was going to ask you have siblings?
I have an older sister, Stacy, yeah.
Okay, and is she a doctor as well?
No, she's an attorney.
So did your father say, you're going to be a doctor, you're going to be a lawyer?
No, not really. He just wanted us to do well in school so we'd have as many opportunities to pursue whatever our interests were, but he didn't push us in any particular directions.
So let's talk about that. Where'd you go to high school?
I went to high school in Oakland, New Jersey, at Indian Hills High School.
Oh, Indian Hills, okay.
Yep.
Did you know back then you wanted to go into medicine?
I knew before that, actually. When I was in 3rd grade, I had surgery on my eye. My mom actually had the same exact surgery the same day as me.
It's hereditary?
Yeah, it was a hereditary eye condition. So we had the surgery the same day by the same doctor in the same hospital in New York City. And
How old were you?
I was in 3rd grade.
3rd grade.
3rd grade. And I was just fascinated, just awestruck with the doctor, the whole atmosphere of the hospital, and from that point on, I knew I wanted to be in medicine. I thought that I wanted to be an ophthalmologist,
Right.
and it changed, over the years.
You got scared in 3rd grade, right? Something happened with the eye.
Yeah.
Did you lose sight in it, or?
No, I had what's called a lazy eye. So my right eye diverted immediately towards my nose, and it affected my vision.
Yep.
And so yeah, I think from there, that's when I knew I was going to do something in medicine.
And so you graduated high school and you went to what college?
So I went to Arizona State in Arizona.
Smart. Get out of the cold for 4 years.
Yeah. My sister had gone there, and while she was there, I went with my parents a couple times out there to visit. And I don't know if you've ever been to Arizona State.
No.
But it's
an amazing
for
place.
a 19-year-old boy, it's quite a place.
Yeah, I'm
It
sure.
was actually.
Well, it's good your sister paved the way, right? She went there.
Yeah.
She got there first. She settled in. You got to go there a couple times without having to go there just on like a tour with your parents later on.
Yeah.
So you were able to like settle in a little with her and kind of say, hey, I like this.
Well, actually, by the time I got there, she had left. And so that probably wasn't the best thing because there was nobody there to keep an eye on me. So I had a little bit too much fun the first couple of years, and
It's understandable.
yeah.
It's definitely understandable.
After 2 years, I decided I really need to rein it in and hunker down and get my nose in the books. So I actually transferred to University of Bridgeport. That's really where I got my bachelor's from, where I graduated from.
So you were like, you figured you had to get out of there, get out of the warm and the party scene, and get to somewhere where it was no nonsense.
Yeah.
Well, that's when you made the decision in your head you wanted to be a doctor.
Yeah.
Right around there.
Yeah. Yep.
Was there anything else you were thinking of?
I thought about going into the restaurant business because my father was in the restaurant business. Of course, they sold the diner, as I said before, but he owned a couple of restaurants and a couple of restaurant supply businesses throughout his career. And in times off from school and on weekends and things, I would help him. And so that was probably the other path that I would go if I didn't go into medicine. Yeah.
Yeah. You ever think about opening up one? Now?
I do.
Like as a place to hang your hat, just kind of, place to hang out with your friends and your family.
I do.
Interesting.
But I know it's a tough business, and you got to be there 24 hours a day, or things just go wrong, and you wind up getting ripped off, and
Yeah.
the quality that you want to present to the community is not quite what it is. It took a toll on my grandfather. I never actually met my grandfather, but and it took a toll on my father as well. I mean, it's a stressful business to be in the restaurant business.
So you graduated Bridgeport, and then what? Where'd you go to medical school?
So I went to medical school at Des Moines University Medical Center in Des Moines, Iowa.
Okay. Did you know then you were going to go into foot and ankle?
Yeah. Yep.
What made you choose that after college?
So my father had a friend who was a foot and ankle surgeon, and during Thanksgiving breaks and Christmas breaks, on maybe 3 or 4 different occasions, I spent time with him. I shadowed him. I went to his office and saw him seeing patients. I went to the surgery center in the hospital with him a couple times, and I just loved it.
Yeah.
And I thought having someone, he was pretty politically active, this guy as well, and he had also gone to the Des Moines school, which at the time, and I still think to a large degree today, was the best program out there. He was politically involved in the school, and so I thought that he might be able to make things easier for me in terms of getting into the school and getting accepted into residency programs and so on and so forth. So. And plus, I love the fact that part of the week he was in the office and part of the week he used his hands. I knew I didn't want to just stay in an office all day and see patients and fill out prescription pads and things like that. So,
that's what made you go into it.
Yep.
I always ask that question because there's always a place and time where you either had a friend, right, that you were able to go to when you were in the summer and peek behind the curtain, so to speak, and see just what happens in that world. And you'll know as a kid, not as a kid, but as a college student, you'll know, 15, 20 minutes, right? Being with them, shadowing them for a little bit, this isn't for me. And then if you, think, well, maybe this might be for me, let me stay a couple more weeks and then figure out. Or some doctors that I interview, they have a traumatic experience that pushes them into that certain field.
Mm-hmm.
They were zigging, and then a traumatic injury happened, and they zagged into that field.
Yeah.
They saw that they got help that way, and they wanted to help other people, and they go. So it's just, I like that. I like to figure that out because the people that watch this, they can, especially kids thinking what they can do, they can listen to what you're saying and say, hey, I know a guy.
Yeah.
Let me give him a call, because when you're sitting there, right, after you graduate college, you're like, how am I going to figure this out? Like, who's going to help me figure out where I'm going to go, right? You can do internships, but there's 70, 80 people trying to get into that internship for one spot.
Yeah.
But if you can listen to this and listen to you where you said you had a friend, your father's friend or something, everyone has a father's friend that could probably bring them into whatever field they want.
Yep.
So, I was reading, Dr. Meyerson is regarded as an international pioneer in foot and ankle surgery. When did you meet and train under Dr. Morrison? How did you get that opportunity?
So this is kind of a neat story as well. So in roughly 2000, I was in the very early beginnings of my residency program, and he had just published what is now, in my opinion, the Bible of reconstructive foot and ankle surgery. And I read it. It was a big 2-volume set, and probably took me about 6 months to read it, but I read it, and then I read it again, and I was just completely awestruck with how much knowledge he had. Huge fan. At that point in time, you could have told me you can either meet Dr. Meyerson or you can meet the President of the United States. It would have taken me a nanosecond. I would have picked Dr. Meyerson.
Right.
So I don't know what was the best me to do it, but I sent, and his textbook, by the way, the two of them together probably cost about $400 or $500, and you have no money when you're a resident, but I bought them. You had to have them. I sent them to Mercy Medical Center in Baltimore, addressed to him with a letter in the package. Stating, Dr. Meyerson, I'm a big fan of yours. I would be honored if you'd sign my textbooks for me, and I sent them off, and I said to myself, "What did you
didn't
do?
expect
You just blew $500. You're never going to see those things again."
Sure.
And sure enough, about 10 days later, I got a package delivered to my door, and it was the textbooks. And Dr. Myers had written just a beautiful thing in the on the front cover of on the front first page of the book. And fast forward a couple years later, I graduated my residency program, and I got the opportunity to go. I got an invitation to go see him lecture at Hershey Medical Center. And I must add that in between him sending the book back to me and this event that I'm telling you about, somehow I found his email somewhere. And I made it a habit of emailing him probably once every 4 to 6 weeks or so, asking him a question that sometimes was genuine, sometimes I knew the answer to, but I just wanted
To keep the line open.
yeah, it was like a star. I got in contact with a star and I didn't want to lose it. So I would send him an email every month or so, and as busy as he is, he has a handful or two of residents and fellows and international visitors all the time.
Yeah.
I mean, he's like when you
He's
when you watch TV and you want to see one of these doctor shows and there's a doctor in the front and there's 20 people walking behind him. I mean, that's him. But when I would email him, I mean, sometimes within 10 minutes, 20 minutes, certainly within the day, he'd respond to me.
So tell me about where you currently practice.
So I practice with Kale Orthopedic Associates. We have an office in Franklin Lakes, Glen Rock, Westwood, and soon to be Paramus by the end of this year, probably.
How long have you been with them?
In a month, it'll be 8 years.
Are you at all the offices?
Yes.
A day here at each
right.
one?
Yep.
And where do you do most of your surgeries at?
I do most of my surgeries at Hackensack University Medical Center in Pascagoula Valley, the Westwood campus, and I do a fair amount of cases at our surgery center in Inglewood Patient Care Associates.
Oh, okay. So in my opening monologue, which you haven't seen yet, I mentioned that you're dual board certified in reconstructive rear foot and ankle surgery. What I didn't mention was that you are one of only 600 or so doctors in the country that can do this. For the patients watching this, first, explain what dual board certified means, and second, talk about what this surgery is about and how it's impacted patients' lives.
So dual board certified refers to being certified in foot surgery, which obviously most foot surgeons who are board certified are going to be board certified in foot surgery. But a small number of us are also board certified in what they call reconstructive rear foot and ankle surgery. And to be board certified in reconstructive rear foot and ankle surgery, you have to meet certain criteria. The surgery, the residency that you did had to meet certain criteria. Your caseload, both in residency and in private practice, have to meet certain criteria, and the number's probably higher than 700 now. It's probably a little bit closer to 1,000, but it's still a small number when you consider there's probably 20,000 of us in the country.
Well, that's important for patients to know, right? That a doctor's board certified when they're doing their surgery or looking for a person to do surgery on them. That's very important.
Yeah, I think it's very important, particularly if you're having surgery, particularly reconstructive surgery on your ankle, or what we call the hind foot or the rear foot, because I think it's somewhat deceptive to fly a flag out of your office that says you're board certified, because if you're board certified in foot surgery, you may very well be perfectly trained and capable of doing some foot surgery, but the more complicated, advanced ankle and foot procedures really, should be done by somebody who's certified in foot surgery, but also the reconstructive part of it.
So when a patient got this type of an injury before reconstructive rear foot and ankle surgery was available, what did they do?
So for the most part, they had surgery, but they had surgery by someone who likely had some training, some experience in foot or ankle surgery, but was not specialized to the degree that we are today in 2018. You know, medicine is constantly evolving, and it's constantly subspecializing. Everybody's fellowship trained now in something, including reconstructive rear foot and ankle surgery. So. You know, that's really how it's changed. There's guys now specifically like myself out there who do just ankle replacements and flat foot reconstructions and things like that. You know, who spend the majority of their time doing those things. Wherein 20 years ago, let's say, if you needed one of those procedures done, you know, you had to kind of take your chances with someone who was more of a general orthopedist or podiatrist, and you know, the results weren't as guaranteed as they are now because the training is so much more specific.
So in 2018, a patient can recover fully and have a normal life and walk and run and do what they want to do?
Yeah, for the most part. The foot and the ankle is unique in that osteoarthritis, which we know is ubiquitous in the hip and the knee, is really not very common in the foot and the ankle. The kinematics, the biomechanics, the type of cartilage, the structure of the cartilage is different in the ankle than it is in the knee and the hip. Thank goodness, if you think about what a beating our feet and our ankles take on a day-to-day basis.
And we don't even think about them.
Yeah, it's rather miraculous that they don't wear out like knees and hips do. But the truth of the matter is that they don't. But what the ankle particularly is sensitive to is trauma. So post-traumatic arthritis, as opposed to osteoarthritis, is largely what I see in my practice. And because you can fall and break your ankle or shatter your ankle in an automobile accident at 13 or 30 or 45, we're faced with seeing these patients who have debilitating arthritis at younger ages because their arthritis is not driven by wear and tear and age. It's driven by trauma.
So you recently made history at Hackensack University Medical by performing the first ever total ankle replacement. Talk about that experience and how that helped Hackensack University and yourself.
So total ankle replacement has been around for about 45 years or so now, but the first 35 or 40 years or so were riddled with bad results, with complications, to the point where 2 times for probably 10 years apiece, the thought of replacing the ankle and certainly the practice of replacing an ankle was completely abandoned. In the early 2000s, the third generation of total ankle replacements came out, much more sophisticated, with a much better understanding of how the ankle works and the demands on the ankle. The instrumentation improved. There are now customized total ankle replacements, which is the one that I perform. And
when you say customized, how is it customized?
So we take a CT scan of the patient's knee and their ankle, and those scans are sent to a group of engineers in Europe who essentially design on the computer the prosthesis. The prosthesis is then sent to the surgeon, and in the comfort of my own home, over the course of a couple of weeks, I will fidget with the prosthesis by way of a computer program that essentially allows me to do the patient's surgery on a computer. And so I can trial and error how big or how small I want the implant, how much I want it tilted or rotated into varus or to valgus. And
are you using the images from the CT as well?
Correct.
Oh, okay. So you have a 3D image on your computer at home, which you can look at and take that prosthetic implant and place it and do what you need to see where everything's going to fit correctly way before you cut that person open.
Correct.
Oh, that's awesome.
Yeah, it's revolutionized how we replace ankles. It's something that they're already doing in the knee, and we've adopted for the ankle. So, over the course of a couple of weeks, I'll do the surgery a couple of handful of times. I'll make some changes. I'll send it back to the engineers, and finally we arrive on a prosthesis that has very exacting dimensions
To that person.
For that person,
Which is perfect.
It'll only fit in that person. It won't fit in anybody else's ankle.
I think that's something, sorry to stop you, but I think that's something for everybody to really understand, that that part that you just finished creating is for that person.
Correct.
It's not one universal part that you're putting in everybody's body.
That's correct.
And I think that's something, that's why I stopped you. I'm like, that's huge.
Yeah, and the benefits are severalfold. None the least of which is not only the accuracy but the operative time. I've already done the surgery on the computer and figured out that I need a size 4 tibial tray or tibial component and a size 3 talar component, and the polyethylene spacer is going to be 6. It's all there. So, in the olden days, and to be honest, still a lot of times today with the more conventional older systems, the surgeon may take a half hour, 45 minutes to dissect down to the ankle joint and get it prepared, but just then he has to start tinkering by taking x-rays and measurements and, do I go with a size 3 or size 3 is a little bit too big, so
all the while the person's under
they're under anesthesia, they have a tourniquet around their legs, so you're making all these intraoperative decisions which take time, and as time ticks away, it's stressful.
Yeah.
So I already know all the answers to all the questions, so when I get down to the ankle, there's no guesswork, there's no pausing for all kinds of calculations and whatnot. I already know what's going to happen, and
so from the time you actually put the person under anesthesia and make the first incision till the time you sew them up, how long?
Well, if it's just a total ankle replacement, it's probably an hour and a half, something like that.
Wow.
An hour
In the old days, how long would it be?
3-4 hours.
Wow.
Something like that.
So that even helps with recovery time.
Yeah.
Right, for the patient.
It helps in every phase.
Less room for infection.
Yep.
Wow, those are big things.
Yeah, and so when we get done doing the procedure, everything goes in the garbage. Whereas with the old conventional systems, when the surgeon finally figures out that he needs a size 5, he tells Joe, go in the back and get a size 5 off the shelf. They bring this thing in. They put the implant, and then they send it back to be sterilized. It goes back on the shelf.
Right.
Whereas everything that I use, it just gets thrown in the garbage. Because even the instrumentation, a lot of the instrumentation is just made for that patient, so it just gets tossed.
Even the instrumentation is customized for that surgery?
Yeah.
Wow. And so that's just at Hackensack University Medical where you do that?
That's correct.
Okay. Wow. And how many of these you do a month or a year?
Again, post-traumatic arthritis is not nearly as common as osteoarthritis. So last year I did between 15 and 20, and that's a lot.
Yeah.
For an ankle replacement. Some of my colleagues probably do that many knee and hip replacements within a month. But it's because they're treating osteoarthritis, not post-traumatic arthritis.
Wow. I mean, that just blew my mind. That whole process is so much quicker now than the old days. And listen, my next question was going to be what do you think separates you from your colleagues in what you do? But I think that kind of sums it up, wouldn't you?
Yeah, it's definitely been my baby for the last 3 or 4 years. Spent countless hours in cadaver labs and in training classes and seminars, and it's been my baby, and it's helped obviously my career. I hope and think it's helped Hackensack. It's something obviously that wasn't done there before that they've been able to promote and bring business into the hospital. So it's been my baby, and it's I would say that's my pride and joy. What separates me from some of my colleagues.
I mean, I've said it a dozen times in these interviews. If you need a surgery, find the guy who does one specific surgery 1,000 times, so that guy knows what he's doing. He's got the latest, tools at his disposal, and he's up to date on all the new ways to get there, and he can do it with his eyes closed.
Yeah.
That's how I feel.
Yeah, and that's just feeds off of what we were talking about earlier. Medicine is constantly, specializing more and more and more and more. 20 years ago, if you needed to have your ankle placed, you were gonna, it's a shot in the dark. You were gonna get somebody to do it who probably never did one before and just was kind of winging it.
So the last question I have on this field, is it good for athletes, or is it not?
The ankle replacement?
Yeah. Could you still be an athlete if you get it, or not really?
Well, you could be a weekend warrior of sorts, but we always tell patients respect the implant. It is, after all, a mechanical device.
Sure.
It has a shelf life. So, there's certain things that we would like patients to refrain from. So if somebody's a heavy runner, a jogger, before they have a total ankle replacement, I'll still let them do that, but on a much
cut down
scale.
You're not doing 10 miles a day.
No.
Yeah.
If you are, you're going to
Wear
cut
it
the lifetime in half of the device.
Do you see anything in the future for that getting better for athletes?
I think at the end of the day, I'm sure the instrumentation is going to improve. The materials that we use are going to improve, but I still think even 20 years from now, I can imagine what it's going to look like at that point in time. But it's still going to be a mechanical device. It's still going to have a shelf life.
Yeah.
And so I think, although they may be more durable and more able to withstand some of the things that an athlete would want to do, I don't think it's ever going to be something that you can put in and just kind of forget about.
Well, listen, I think if you give those weekend warriors that kind of hope from a devastating injury like that, they'll take that.
Yeah, of course.
As long as they're moving.
Yeah, exactly.
They're in the game a little bit, they'll take that versus the alternative.
Of course. 20, 30 years ago and still, in small bits and pieces today, the gold standard had been ankle fusion. If you had end-stage post-traumatic arthritis of your ankle, you got a fusion. And the fusion does a great job of mitigating pain, but it's at a huge, obvious expense. You can't move your ankle, so...
Yeah. So do you have any children?
I have a 13-year-old daughter, Katie.
Does she play any sports?
She is gonna play volleyball this spring. That's really gonna be her first endeavor into sports. She's definitely more of an artsy music kid in terms of her interests.
Does she have your height?
She
for
does.
volleyball?
She does.
Oh, so that's perfect.
She does. I'm trying to get her into basketball as well, but yeah.
So is it a sport that you played growing up? Volleyball?
No.
You played basketball?
I played basketball.
In Indian Hills?
I didn't play in Indian Hills.
Okay.
No. But I played football, baseball, hockey. Whatever the season was. In the fall, basketball, football.
Right.
In spring, baseball.
You mentioned that she's into the arts. Do you think she's going to follow in your footsteps of being a doctor, or do you think she's going to go in another direction? Or is it too early to tell? Is there any glimmers of anything?
Well, I don't think she's going to go into medicine, which is fine by me. I think she's actually going to follow my father's initial footsteps. She loves singing. She definitely has my father's voice. And we've taken her to a couple different studios, and she hasn't done anything significant at this point, but she just loves to sing, and she's really good at it. And if you ask me right now where she's going to wind up, that's what I would say. Probably.
Are you going to have her go get her degree anyway, regardless of what she's doing, right?
Yeah, I pound into her all the time.
Yeah.
Make sure that you're prepared for everything and anything, and prepare yourself so you have the option to pick what you want to do.
I would think that you having your father in that business, even though it was so many years ago, you could be a student of that game, so to speak, now, and kind of find the road for her to get her. Is that what you're doing?
Yeah.
Kind of get where you need to go and start talking to different people Is that tough? Is that hard?
It is hard. I had the fortunate experience of about 6 months ago doing surgery on someone whose name I don't feel at liberty to say, but he's he's a well-known producer and been in the business for a long time, and thank goodness his surgery went well, and I got to know him pretty well over the course of the few months of his recovery, and he actually has been kind enough to bring her into his studio and to some of her shows, and so just by happenstance, I haven't really had to go out myself and be the one to.
That's good.
Yeah.
Wow. That's awesome.
It's fate, almost, I think.
Yeah. So have you heard her sing? Like,
oh yeah,
she belts stuff out for you all the time?
She's, oh yeah, she walks around the house constantly singing, constantly.
Yeah.
Eating breakfast, singing, brushing her teeth, singing, to the point where sometimes I have to tell her, Katie, stop singing, because it takes her 10 minutes to do something that should take 2 minutes because she's singing.
Now is she's going to go to the high school you went to? Or?
No.
Okay.
She's not going to go to the high school.
She's going to go to a different high school.
Yeah.
Okay. And wow, that's awesome. So with being such an accomplished surgeon and all that comes with it, would you say, you're welcome, would you say she is your biggest accomplishment or challenge?
Both. Definitely both. Yeah, she's by far the best thing that I have ever been a part of. And definitely raising her, because I'm doing it by myself, is the hardest thing I've ever done, but also the most fruitful and rewarding.
Yep. Being a single parent is always talked about from the mother's perspective, but I don't think it's really talked about much from the father's perspective.
It really isn't.
I don't see too many TV interviews or articles in the newspaper about how hard it is being a single father and raising a daughter or son or multiple kids. Yeah. It's not easy.
No.
And it's not talked about as much as it should, I would think.
Yeah.
Right?
When I tell people that I'm a single father with full custody of my daughter, I always get a look of surprise, because as you said, most times you hear something like that, it's the mom who has full custody. But it's a challenge, but I love it.
So, how did being a dad change you as far as being a doctor before you had her and after?
I think it just it's made me more compassionate, certainly. Particularly when I'm treating children, I now know how parents feel about their children and how important they are to their children. And it's also, I think, made me a better clinician, better surgeon.
You listen more, probably.
I listen more, and everything I do is for her. So I want the best for her. I want her to be proud of me, and in order for those two things to happen, I feel like I have to give my all to my practice and my patients. So everything is out on the internet these days. I have all these sites that rate physicians and rate doctors, and I want her to be proud of me. I don't want her to see something derogatory about me on the internet. So I'm always thinking about the patient first and taking care of the patient's needs first, but I always have in the back of my mind that I need to make my daughter proud of me and never do anything that would cause her any shame or whatnot. And so I think those things have made me a better physician. Yeah,
for sure. I mean, I'm way behind you. I have a 3.5-year-old girl and a 2-year-old boy, and I tell you, my daughter changed me dramatically as far as compassion, as far as listening and patience. Those are the 3 top things for me that changed. I wouldn't say overnight, right? I'm not going to get that crazy, but I would say over the first year.
Yeah, it happens quick though.
Yeah, the first year, those 3 things were huge. I started seeing a different part of me, and that was good, right? Like, you grew as a surgeon before you had kids, getting razor sharp in what you needed to do, and then would you agree that after you had your daughter, you were able to get razor sharp on
the compassionate, on the listening, on the, those
Yeah.
parts of making that patient,
Yeah.
Seem very comfortable
Yeah.
with what you're got to do.
Yeah, I think before she was born, as you said, I was honing my skills, focused on the X's and O's, if you will, of medicine and surgery. And after I had her, I was more focused on how to deliver and present those skills to patients, and to be compassionate and careful and mindful. And that all stemmed, I think, from having a daughter, having
Yeah.
a child.
Yeah.
And I think particularly a daughter, as you know, there's nothing like daddy's
No.
little girl.
No,
So
no,
it just
really is.
makes you a little soft.
Makes me smile right now, just thinking about it.
Yeah.
So when, where do you, between your daughter and your career, do you have time for any hobbies or sports or anything? What do you do to relax yourself? Do you have a room that you're listening to music with? Do you like going to sports games, sporting events? Do you like going to see MoMA, go to the museum? What do you like to do?
I like to
you.
be outside. I like to hike. So I go on a lot of hikes with my dog and my daughter. I like to work outside. So during the summer, early spring and summer, on the weekends, you'll find me out in my yard, cutting the lawn and doing all those kinds of things. As far as sports, I actually just started playing some pickup basketball in the men's league. That's about it.
Yeah. What's your dog's name?
Winnie.
What kind of dog?
So she's a pit bull terrier mix. She was a rescue dog.
Yeah, I was gonna say.
She was one of twins. Mitzi and Witsy were their name. We picked Witsy, but my daughter didn't like Witsy, so she changed it to Winnie.
Yeah, I mean they're the most loyal dogs. Loyal to the
Amazing.
day is long.
Amazing.
And they're smart.
Yeah.
My
they are.
my
Smart
roommate
as
and
well.
I, he had a pit bull terrier mix called Chiclet, like the gum.
Yeah.
That dog was so smart. We were roommates in a elevator building in Hoboken. The dog figured out a way to open the door. Because if you pulled the handle, it hit turn the bolt, the deadbolt, and open the door.
Yeah.
Figured it out. Went to the elevator, waited for it to go up. Was going up and down. We were out at a bar, and we get a phone call from the building management guy, superintendent. And he's like, "Hey, your dog's in the elevator, going up and down with people. People don't want to get in the elevator. Some people get in the elevator, some people didn't.
Yeah.
But those dogs are very loyal and very intelligent.
Yeah.
And they're great to hike with.
Yeah.
Because they're
she's,
strong. They can go wherever you want them to go,
She
right?
doesn't stop. She can go all day long. And just loyal as can be and loving as can be. I think pit bulls really do get a kind of a bad
They
rap.
do.
She's such a soft and gentle dog. She's the third leg of our family, no question.
Anybody that's out there, if you want to rescue a dog, go rescue a little pit bull puppy. That dog will be so loyal to you forever. It'll protect your family, and they'll give you nothing but kisses. They're not going to bite you and latch on to you.
She's a big love bug.
This segment of the show is called Stat Chat. Stat is a medical term which you know, meaning right now, and chat meaning I'm going to ask you a series of questions. You have 1 minute and 30 seconds to answer as many questions as you can. Matt, start the clock and the funny music. What's your favorite sport?
Basketball.
What's your favorite team?
New York Knicks.
Favorite player? Could
Patrick
be old
Ewing.
or new.
Patrick Ewing.
Ewing, I'm with you on that one. Favorite type of music?
Anything but country.
That's my wife right there. You must go see one concert, Taylor Swift or Lady Gaga. You gotta pick one.
Oof. Hopefully my daughter is with me. I go Taylor Swift, I guess.
Okay. Favorite movie of all time?
Raging Bull.
Favorite actor?
De Niro.
Coffee, leaded or unleaded?
Definitely let it.
Last fast food you ate?
McDonald's.
Favorite word?
Favorite word? Operate.
Salty or sweet?
Salty.
You're trapped in a supermarket. What do you eat first?
Pomegranates. I'm a pomegranate maniac.
If you weren't a doctor, you would be?
Restaurateur.
If you could talk to anyone, dead or alive, who would it be?
My father.
Stop the clock. Good job. So the last segment of the show is called Before You Go. This is where you give one tip to future patients that will help them navigate their visit to you. So just one tip.
Tell me everything. The smallest detail, or what the patient may think is an inconsequential detail, can totally change the course of their treatment, their workup, how I formulate their diagnosis. So yeah, I would say tell me everything. I pride myself on spending time with patients and really giving them an opportunity to talk. And one of the primary reasons for that is 80% of the diagnoses I make are based strictly on the history that the patient provides me. And things as simple as what kind of shoes you were wearing when you fractured your ankle.
Dr. Rappaport, thanks a lot. Appreciate you being
Thank you so
here.
much for having me. Appreciate
All right.
it.